The Connecticut Hospital Association and the Connecticut Department of Public Health are pleased to present the 2023 Connecticut's Hospital Community Service Award to St. Francis Hospital for its Hospital Violence Intervention Program.
We really need to understand that as a healthcare system, we have to be trauma-informed. We know that these individuals will come to our hospital. They will be treated in our hospital. And how they are treated really determines their path forward after they leave us. And so this program is really instrumental in being able to build that out and be able to ensure that these patients are being treated equitably and fairly and with dignity, which is one of our core values.
We know that, unfortunately, people when they're injured are more likely to get injured again. So the idea of these wraparound services is to get these folks when they're in the hospital and ensure that they have resources that maybe can prevent these from occurring again. Make sure that there's outpatient sources, whether it's support groups, activities to keep people active.
There are a number of community organizations. There is a violence prevention specialist who is embedded right in the emergency department. And then the team also, of course, includes all of the nurses and social workers and physicians and other support staff in the ED in and of itself. And really, that group forms a comprehensive team which provides the service to these members of our community.
Well, I think it's all about relationship building. I kind of build those relationships when I first come in, being there during your most vulnerable moment and letting you know that I am here as your advocate. And I kind of build that relationship where they feel comfortable and I'm that trusted messenger for the patients essentially. And then they're more open to letting people in to help them with whatever issues that they're struggling with.
You know, some of the wraparound is the idea of they're in the hospital. We use this as an opportunity to intervene and to provide support to prevent something from happening in the future, to provide someone with a mentor or a resource that can help to support them.
This program has had tremendous sustainability and longevity because it involves a whole host of community-based and hospital-based organizations. It's not just a hospital program, it's a program the hospital participates in with support and involvement and partnership from community organizations as well.
The program that I actually run is the TEP program, and TEP stands for Transitional Employment Program. Here at the food pantry, we give the kids a chance to work around their mistakes, to grow and actually be better in their community as well as in the place of employment. We deal with the high-risk youth. The more they're involved in something positive, the more they're off the streets.
I think the idea of the partnership really is critical because we are able to connect that physical health, well-being, mental well-being, and then the mentorship. We are meeting the patient's bedside, making sure to reduce the potential for future victimization by making sure we're connecting the hospital-based services with the community services. And if it wasn't for the fact that St. Francis gives us access, we may have some youth fall through the cracks. But because we have the partnership with St. Francis, we know when someone has been a victim of violence that we can go there, we can meet them with the purpose of not only having the physical healing, but the mentorship and behavior change over time.
I think it's important for hospitals to provide that role because we have been embedded in these communities for many, many years. We're going to provide that immediate life-saving emergency care, but we're also going to now work with our community organizations to provide you that wraparound care to ensure that we're doing everything we can to support not only the victim, but the victim's families as he or she moves back into the community.
I mean, really, it's everybody. I don't think it could be successful without any member. You know, they're all pillars to the entire program. We want to be able to provide the care we're able to give the community.
We can do so much more for our community if we think about the resources and opportunities we have available within our healthcare system. And that's where I feel like connecting those dots and creating those opportunities really demonstrates to our community that we're committed. We're committed to them for the long haul.
When I come into this work, it's not about me. It doesn't matter what I have going on. Right now, it's about this patient and what they need and how I can help and how we can work collaboratively to give this person a wraparound service, but to be able to change someone's outlook and say, you know what, let me change the way I'm thinking and let me turn my pain into purpose. I think that's the most meaningful piece of this work.